All right, so let's get right into the exercise for the lower back and hip pain. This, by far, is it's a modification of one of my favorite exercises and also my clients, because I get so many comments on my online program that this was the one that fixed everything. So, as you can see, I'm already in the position of it, so I'm gonna back up. What I want you to do is sit on the foam roll, just like this, just as if you're sitting in a chair. I'm gonna work on my right leg because of the camera angle. So what I'm gonna do now is I'm gonna take my right leg and I'm gonna turn it into the dead leg position. So that means I'm gonna turn it out and I'm gonna bend it slightly. The reason I say dead leg is one, because it's like my leg has no tension at all, like it's dead, and two, because the area that we want to work on, we want to make sure the muscles are as soft as possible, as supple as possible. So for example, if I were to flex my bicep and then try to massage it, it makes no sense. I need my arm in a relaxed position so I can get deeper in that muscle. So same thing here. If I'm here, it's not wrong, but this is gonna, A, is gonna relax the muscle, and B, because of where I want to go, it's gonna allow me in a second, as you see, to go a little bit more on the lateral side. So from here, I'll show you the first position and then the position that all my clients love. So this would be before I get ahead of myself. Position number one would be here. This is what you guys have done 1,000 times and most likely is helpful, but doesn't really seem to be the game changer, because your problem most likely is not here, because if it was, it would have been solved by now. What I'm gonna do now is I'm gonna go on my right elbow, because it's my right leg that is bent and relaxed and dead, if you will. So from here, you can keep your hand on the floor if you want, your left hand. It's a bit of a stretch and for some people a bit uncomfortable, or you can set it right here. Now what you want to make sure is you don't over rotate, because that's actually going to be the final position. So from here, I'm up, I come down on my elbow, that laterally rotates me a little bit more, so I'm facing you a bit more, and then I can set my hand here. So this is position number one, because the advanced position might be difficult for some with flexibility or just a bit too painful. So the next position is going to be, you take your leg and you raise it up like this. So now I'm in this figure four position. It's also a bit nice because then you can put your hand, you have more options where you want to set it. And from here, what this is doing is this is opening my hip joint a little bit, and it's allowing me to get a little bit deeper in those muscles. So from here, I'm able to just get more of an advanced position in a more deeper mobility and or manual therapy treatment, if you will. In this one, I've always enjoyed it, but the amount of people on my online program that say that this one was the game changer is exactly why I'm doing this video. So from here, as you can see, as I'm chatting with you, I'm rotating myself. As you can see, I'm turning myself a little bit, searching for my own trigger points. I always say that, you know, the body is 95% the same as the caveman and cavewoman. So in that sense, we're all gonna respond to treatments similar, so to speak, but we're all gonna have different skeletons in our closet. So that means we're gonna have different trigger points from the way our body reacts to things, our lifestyle, our daily activities. So that is why I am moving a little bit in different positions, because I am searching for my own trigger points. I just came back from a salsa conference in Paris where I was dancing, oh God, like 8 hours a day. So this feels really good. And I actually do have trigger points and I can find one right there. So as I find one, I just stay in that area, try to breathe and relax a little bit. You see, I modify my left leg, which is my movement leg in this one, just to kind of give me better balance. And the other nice thing with this is I can also then set my hip on the ground. And from here, now I can use my second hand because I don't need it. You can hold your heel if you need to, but in this position, I can really just get that gapping, meaning opening position of the joint, and just really work right now on the front of my hip flexor. Actually, I'll show the muscle right here. This is actually a rectus femoris, and as I like to call it, kind of the highway to hell, because you've got basically all of your hip flexors crossing through here. You've got your psoas major, your rectus femoris, which is an interesting one because that's a quad muscle, so it also kicks the leg out like this, like the quads, but it also raises the knee up like this. So this one is often a little bit annoyed and upset, but let's see, let me go back. You've got your psoas major, you've got your rectus femoris, you've got your iliacus, which is a small one that really tugs on the SI joint. So if people with lower back pain, it's often that muscle right there, especially when you throw your lower back out. Then you've got your sartorius, which is an interesting muscle. That's actually the muscle that does this right here. And then I am totally going blank on one, rectus femoris, psoas major, iliacus, sartorius, And there's definitely one more, and I think I'm going blank on it. You get your psoas minor, obviously, but either way, it's the highway to hell. So this is a great way to get in there. And like I said, if you want, you can hold your heel there, and you can also come back up in this position, go into the traditional kind of figure 4 piriformis roll. Now, a lot of people say, but I watched a YouTube video, or someone told me that foam rolling is not good for my hip, and I shouldn't do it, and it's gonna make it worse. Try it, and if it feels better, then it works for you. My concept consists of movement. Do we move enough? How do we move? Mobility, basically manual therapy and soft tissue massage, often with an inanimate object. Strength, do we have enough, or is there an imbalance? Flexibility, are we able to get in the positions that we need to? And then finally, lifestyle. Are we sitting? Are we standing? Are we moving? Are we doing the things that we need to do? And out of those 5 pillars, if you will, this is where chronic pain comes from. So if you do this exercise and you realize after it feels better and it feels released and you feel better, less lower back pain, well then for you it works. Because at the end of the day, anything that is not synthetic, so to speak, like medication or injections or stopping what you love to do, is always a win. So for example, people ask me what I think about chiropractic. Does it work? Yeah, sure. I mean, short term. But is getting your neck cracked 1,000 times better than taking ibuprofen for a headache? 100%. So give this exercise a go, see how it feels, and if it makes you feel better, continue to do it. And if you realize that your symptoms become less and less and less the more you do it, then the exercise works for you. If you want to learn more about these 5 pillars, this concept behind how you can understand basically the language that your body is speaking, which is pain, and how to interpret it to know what you need to do versus just feeling like you have to take medicine and pray to the gods that it goes away, definitely check out my online program. The 10 days are free, the first 10 days. You don't even need a credit card. I've set it up to where you can literally just type in an email address and get started and start to learn about your own body. And if you have any questions, reach out to me, email me, write me on Instagram, American PT Stuttgart. Write me here, send me an email, do whatever you want, because I'm here to help. I don't do these videos for me. I do them for social engagement and to help. So again, you can see as I do this exercise, I continue and I'm able to speak with you. If you find that this is so painful that you're really not able to breathe or talk while you do it, that is your body telling you that there's something going on, and this is where it wants the help. Taking an ibuprofen is just like unplugging the check engine light and continuing to drive. That's not what we want to do. So give this exercise a shot. If you can't get your leg up there, it's not a problem. Just start in this position. If this is too painful for you, soften the floor. I have clients do this on a mattress, for God's sake, in their bed. The point is not that it's so painful we can't do it. It's just to start doing some tissue work so we can start getting that blood flow back there, so we can start making the area more supple. And when the area is more supple, it moves better. And when it moves better, you move better, and when you move better, you don't have pain. All right, so this is where I do a little exit video so all the little things can pop up here and people have time to watch a next video. However, if you have not signed up for my page, please click the like button, the subscribe button, the notification button. Check the online program out below. The first 10 days, like I said, are 100% for free. You don't even have to put any information down other than an email address, and then we can get started. And at the moment, depending on when you sign up, everybody that does sign up for the free 10-day program, I shoot out a message to, and we can actually chat for 30 minutes, and I can learn a little bit more about your pain, and you actually speak with me. Like, we're on a video. It's not some AI version of me, and it's not some assistant or some virtual assistant in Thailand. You're talking to me. So check out the other videos. Please subscribe. Let me know how this one worked for you, and I hope to see all of you in my online program.